And I'm still waiting for the special report. Awesome. Okay, I'm pressing going live.
Passionate, outspoken, insightful. Ariva Martin is an award-winning civil rights attorney, best-selling author, legal commentator, and America's advocate. Live from Los Angeles, this is the Special Report.
Good morning and welcome to our viewers in the U.S. and around the world. To kick off this morning's broadcast, do me a favor. Please share the show with your online friends or start a viewing party. And remember to post a comment or question. Your voice matters, and I want to hear from you. Several weeks ago, some of America's elementary and high schools began opening their doors for the 2020 fall semester. The decision to reopen was the subject of heated debates between educators and elected officials as parents grappled with trying to determine if it's safe to send their kids back to a classroom setting. The decision to reopen schools has been made more difficult by the fact that coronavirus cases top 163,000 nationwide and are continuing to spike, particularly amongst younger people in the South and Southwest. And by a new report from the American Academy of Pediatrics and the Children's Hospital Association, that report reveals that over 338,000 children have been infected with coronavirus. 97,000 of those cases were reported in the last 2 weeks of July alone. These jaw-dropping numbers haven't stopped Donald Trump or some Southern governors from continuing to demand that schools reopen for in-person classes without exception. Though Trump's top coronavirus doctor, Dr. Deborah Birx, urged districts that are seeing a spike in coronavirus cases to suspend in-person classes. So who are parents and school districts to listen to? Today, we are taking a closer look at the ongoing debate to reopen America's schools. Let's get started. My first guest is a Los Angeles parent who has come up with a creative way to educate her 12-year-old daughter, Amanda, without her ever having to step foot inside a classroom this semester. Welcome, Victoria.
Good morning.
Good morning. Thank you so much for joining me this morning. This has been such a nail biter for so many parents who've been waiting for some direction from our federal government or from our state government on what they should do. But you stop waiting. You took control of the situation. So tell us about this creative solution you came up with for your daughter.
So now it's been over 5 months, as we all know, that we've been in quarantine, and I'm a therapist mom, and I was concerned with my daughter's psychological needs and her emotional needs. And she's an only child and she's 12. So she's been isolated for almost a half a year, minus some play dates at the beach. And so after long discussion with another family at her school, we decided that we're gonna be a pod and we're gonna allow our children to have overnights, and because we may be in for 12 more months or even longer. So we just thought realistically, I can't have her not around another child for a year. So it mitigates the risk somewhat. So she's not around 400, 500 people at her school. So she's with one other family that we've talked through our safety concerns. And so we're gonna ride it out this year with one other family.
So I know, Victoria, you said you didn't do this for academic reasons. This is really about her social emotional growth. But do you have any concerns, academically, that I know you are a super smart woman. I know you're super educated. I know you work in the mental health field, but do you have concerns about, like teaching her science and, math and some of those other subjects that so many parents say, look, that's way over my pay grade. Do you have concerns about her academically?
The biggest thing that we were concerned about was really like emotionally, and would she stay wanting to try in school? So thankfully we got her grades and she went up in every subject. And my husband and I kind of have a divide and conquer. I really can't tell a computer button from another, and he helps her with coding. And I luckily am good with math and science, and he's good with writing. So between us, but I'm really sympathetic to parents that maybe don't have those abilities to divide and conquer. And we're also able to work from home. So she's really lucky. But the biggest hurdle for us was that we couldn't stay on Wi-Fi at first. So we had to re-upgrade our house. So I also know technology-wise, we bought 2 more computers, we rewired our house, and I know not every family is able to do that. So those are the things that concern me the most.
Yeah, I want to bring into this conversation another parent, Kelly. She's actually in Arizona. She's the parent of 2, and she's, like so many parents across this country, grappling with what to do with her 2 kids. Good morning, Kelly.
Good morning.
Thanks again so much for joining us. Did you have a chance to hear what Victoria, she's come up with this really creative solution for her daughter, an only child. She's going to put her in this pod with one other family. I know you have 2 kids and you've expressed concerns about the Arizona school district reopening, to in-class instruction. Have you made a decision about what to do this school year?
Yes, I have. Actually, school started for us last week, all online. So my 2 children had distance learning online at home with me, and we won't be going back until at least October in person, and that's only if it's safe. So I feel comfortable right now with us being at home. It's just a lot of work, and I feel for the parents who are at home with their kids trying to do the homeschooling with them.
So have you given any thought to like what Victoria is doing, maybe finding another parent in your neighborhood or in your community and creating this kind of creative pod where your kids will have access to other kids?
I think that's a great idea. I work in a school district, so I'm a teacher, and my hands are like really deep in what we're doing. And I feel confident with the learning that's going to be coming across, like academically. The social piece is a whole nother story. And I do feel that that's probably the biggest loss with having distance learning, is that our kids are going to miss out on that social aspect. So I haven't gone too deep into thinking about what I'm going to do with them, but that's a great idea of getting them together. It's just balancing that if you are a working parent.
So I want to ask both of you. So Kelly, I know you said in Arizona, school won't be resuming in terms of in class until October. Victoria, I know you're in Los Angeles, and Los Angeles Unified won't be starting in August or September. I don't think they've indicated when they would start, but let's presume both of these school districts decided that they were going to open their doors and they were going to invite kids back into the classroom. Would either of you send your kids back into a classroom today? I'll start with you, Victoria. Would you send your daughter back into a classroom?
And not with Trump as president, and not having tracking. Since we don't have I don't have trust. So in fact, the reason that we paired with another family, I got that from what Canada's doing. I go to BBC for news and otherwise, so I don't have trust that I felt let down when I stayed at home. I expected my government to do something, and I haven't seen our federal government mitigate any risks. Like luckily we're in California, where I feel like our governor and mayor of LA and Karen Bass and my local, Marquise Dawson is doing the best they can to keep us safe. But until we have better, we're having, robust testing in California, but unless we have tracking and more effective places for people to quarantine, she's not going to go back to school.
What about you, Kelly? When the doors open in Arizona to school districts in October or November or whenever that is, will you allow your 2, kids to go into a classroom?
I feel much more confident doing that now that Arizona has released some criteria that we have to meet it before kids are allowed to go back to school. So when I said we're going back in October, that was what our district decided before all this. And that was only if it was safe. So if we can meet that criteria and the cases are low enough and safe enough, I would feel comfortable, but that would be based off of scientific numbers and really proof that the numbers are low enough, but not until then.
What are the criteria that's been set in Arizona? You said cases being lower. Is there anything else that has to be met?
It's all around the COVID cases. So cases being lower, the number of, I believe, hospitalizations, there's 3 pieces now. I can't remember all of them off the top of my head, but yeah, there's 3 indicators, and there's like a safe range where schools are allowed to go back, and then there's like your cleared range kind of. It doesn't mean that schools have to stay online until then, but that is the criteria that they're encouraging schools and districts to follow.
So I heard you talk about cases being lower, possibly hospitalizations being lower, but what about what physically has to happen inside those classrooms? So it's great that cases are lower and hospitalizations are lower, but what about masks and social distancing inside, the actual school building itself? I think that's what has so many parents afraid. We've seen these horrible images of kids crowding into, hallways and schools not having the resources to actually make the building, safe for kids. So do you have any concerns about, even with those, decreasing numbers, that Arizona still has not done enough to make the school building safe?
Definitely. Right now, I would not go back for sure. I am fortunate to work with a great school district, work within one, and we had some task force that worked together before we knew when we would be opened, and we were preparing just in case. So our school district we have tons of masks, face shields, we purchased new desks. They went in and measured and to determine the number of kids that could be in each class. So we put some criteria down and have established guidelines for when we do return to physical school, just to help make it safer. But yeah, I think that we'll learn from other schools. That's another big thing. Other schools that have been opened in other parts of the world and even our country, just like learning from them and seeing what's working and what's not.
Yeah, I want to bring into the conversation now Dr. Candace Jones. She's a board certified pediatrician and one of the spokespersons for the American Academy of Pediatrics. Thank you so much, Dr. Jones, for joining us this morning. First, I want to start with the AAP. It looks like they had issued a statement a while back suggesting that kids should go back to school. And then it looks like there was some reworking, maybe walking back that statement. Can you tell us, where is the Association of Pediatrics today on whether kids should be going back to school?
Thank you for having me today. The original statement from the AAP and the so-called walking back, I feel like it was more of a misrepresentation of what was said in that statement. People just really didn't delve into it. And so they felt the need to clarify, right? And we saw our president state before our Congress that the importance of safety prior to going back to school. So the goal is to keep kids physically present in school because we know school has such wonderful benefits. But with all things considered, considering COVID activity in the community, the input from health officials, the concerns of teachers and parents, available resources to keep the school safe and the students and the workers and the teachers safe, and the capability of the school to implement those strategies, that's a lot. And so that has to outweigh the benefits of school for kids. And that's kind of what the statement in a nutshell was saying.
So you've heard Dr. Jones, Victoria, our parent who has a 12-year-old in Los Angeles. California has been one of the states now that has a resurgence of cases, and one of the largest school districts, probably the top 3 in the country, that says that we were not going to start in Los Angeles in-person instruction. So Victoria, being creative, and she said following this Canadian model, comes up with this, this pod concept for her and another family. What do you think about that? Is that a viable model? And is that something that other parents should be considering?
I think it's wonderful. I think it's creative, and I think it's safe. One of the high priority strategies, even when we think about a physical schoolroom setting, is to cohort kids, the same kids, the same teacher, and keeping those numbers low and physically distancing and all of those safety measures. So getting together with another family who's like-minded like you, being safe like you, to get the children together to get their academics, to have their social and emotional taken care of, and their physical exercise. I think that is a wonderful model. With that being said, all parents may not be able to do that. And for parents who choose to put their children in school physically, we all have to make the best decision we can based on our circumstances.
So we know, Dr. Jones, Donald Trump said recently that kids are virtually immune. He said, And I just want you to clear that up for us, because that again is the kind of information that parents are working with. The president goes on and says kids are immune, they're safe. It's safe to have them back into classrooms because he's basically saying they can't get the virus and they can't spread it. So is that a blatantly false statement?
It is false. We are constantly getting data. Studies are ongoing, looking at every aspect of COVID, as we know. Just this week, we're seeing studies that are showing that trend of disproportionate effects of COVID on communities of color in Hispanic and African American children, right? We're seeing studies out of other countries that say kids 10 and up are just as likely to get this virus as adults are, right? And so we have been saying, even from the AAP, that kids are less likely to get it, less likely to be as severely affected, may even be less likely to spread it. But less does not mean none, and less does not mean they cannot get this virus and have poor outcomes. So no one wants their child to be amongst that number, even though the numbers may be low.
And you heard Kelly, Dr., and thanks for clarifying that. You heard Kelly say that Arizona has this criteria that they've set, decrease in cases, decrease in hospitalizations. But I still worry about what goes on in the building. And we hear school districts across this country say they don't have enough money to do what it's going to take. There may be some pockets of districts that are in wealthy communities that can, purchase all the PPE and spread the kids out because they have the physical space. But we know that's not the reality for the majority of public school kids in this country. So what would it take for a school to really be, prepared to welcome kids back?
They need a ironclad plan that incorporates health official information from parents and teachers and those everyday workers in the school. Everyone needs to be at the table making those plans. Number two, we have to be realistic about implementing those safety strategies. We've already seen a school go viral for having students packed in a hallway when changing classes without wearing masks and without social distancing.
Yeah,
I don't know what their plan was, but I'm sure they may have had a plan and that broke down, right? And so teachers have reached out to me and said, yeah, we can say we're going to do all this stuff, but I'm not convinced that I can actually do all of this. I don't have the resources. I'm having to pull stuff out of my own pocket. I really can't control a 5-year-old as to if they wear their mask or not. And so there's so many elements in there. And I just want to say nothing is 100% risk-free.
Right.
All we're trying to do is reduce the risk and reduce the spread of this virus. So we have to keep that in mind also.
Well, I'm really glad that Victoria and Kelly are talking in a more positive, upbeat way about homeschooling. I'm actually the parent of 3 kids, one special needs. So I understand the struggles of special needs kids, but I also have 2 kids that I homeschool. And one of my daughters graduated valedictorian and, went on to college and graduated summa cum. I mean, she just did fantastic. But the point is, homeschooling isn't all bad. It's gotten a bad rap. So what can we do to help those parents out there that, and I know there are a lot of working class parents that it's not the homeschooling, it's the reality that they have to go to work and that they're managing so much. But I think we need to do a better job of promoting distance learning, because it has a lot of positives, and you can produce really well-educated, super smart kids like my daughter, who didn't step foot in the school after 4th grade. So, what can we do, doctor, to just kind of reverse some of the negativity around distance learning?
You're absolutely right. Homeschooling is a viable option for some families and some kids. This is where we have to look at ourselves as parents and our family unit and what we're able to do. If you are able to get resources, right, and teach your child at school and then organize their social, emotional, and their physical activity as well, then absolutely go for it. But if you're a parent who has a child with particular learning ability or behavioral problems or need the support services from school or the lunch from school, then for you, it may not be possible to do that. So I think all of the options can be seen as positive. They just have to fit your life and you make that decision.
Yeah, no doubt there's an equity issue here, and we should never gloss over that. It's a huge equity issue, and so many kids in low income and working class communities, even here in Los Angeles, there are kids who did not even get computers, during the last school semester. So we know there's a Wi-Fi issue. We know there's a computer, access issue, and those issues concern us. There's the hot lunch that you talked about. There's the trauma that so many kids experience at home where school is a respite for them. So there are huge issues that we have to consider. Before I let my parents go, I do want to ask Victoria, how are you and this other family making sure that you all stay safe? Are you testing weekly? Are you testing monthly? And what should that protocol look like, doctor, if families do decide they want to follow this model? How do you make sure that no one's bringing, an infection, particularly since they're asymptomatic super spreaders in all of our communities? How do they keep themselves and their kids safe?
That's a great question, because we also have some challenges with getting timely test results that really could be helpful to what we should do when we get a positive or negative, right? I'm even having that challenge in our small practice here in Orlando. Our test results are taking weeks to come back when they're useless to me at that point, right? And so this is where parents really need to understand what the protocol and plan is for their school and their district. Ask those very important questions. How are you testing the kids? How are you going to identify kids who have symptoms or not? How will you pull that child and those people who are exposed out of, because this is going to happen. And is there a plan to shut down briefly? That particular school that we mentioned now has closed and gone to virtual learning for a time. And so it will be a back and forth, and we all have to be flexible.
Victoria, do you and this other family, do you all have a plan, like a testing plan?
So we don't have a formal protocol. This has just been hatched in the last week or so. But two of the criteria regarding testing the safety is motivation. So I'm a cancer survivor. I met with my oncologist at Cedars-Sinai, and I was told that since I'm out of active treatment, I got done with that in 2010, I don't have an increased risk, he said, of contracting COVID. But if I were to contract COVID, he said he has patients that are cancer survivors and they don't know why, but they're having more severe reactions. So this other family also has a parent that has an underlying condition. So we both are extremely motivated to stay inside. I physically haven't been to a grocery store. I haven't been anywhere beside my oncology appointment, and I just had one. So I'm pretty sure at this point that I don't have the virus. And they have been tested more regularly because they had been doing some traveling at the beginning of quarantine. But we both have been, that's one thing that we talked about, like how do you get your groceries? How do you, just what kind of risk are you taking? So I am aware it is a slight risk by pairing with this family, but because they're being so strenuous and they have the motivation because one of the parent has underlying health conditions, that's one of the reasons that makes me feel comfortable with this family.
Wow, and that's great. And I thank you for sharing that, Victoria, because we know that underlying conditions we've heard so much about it, particularly amongst African Americans and Latino families, that those underlying conditions can really, make contracting the virus even more complicated. Is there a plan that you think, Dr. Jones, that Victoria and her, pod group should put in place? Like, what can they do? Because somebody's watching this and they're going to be so inspired by Victoria and this plan, they're going to want to go and do it. So we want to make sure that they have some parameters around how to do it and do it in a safe way.
I would look to, first of all, kudos to you, Victoria, and your pod.
Thank you. And thank you for the advice too. I appreciate having professional advice. Thank you.
Thank you. I think you're doing a wonderful job. And as far as a testing protocol for you and the pod group, I would look to the CDC or your local health official. You can look at the the school district at your school, and not so much that you think it's great, but you're researching and you're collecting information. So you can discuss that with the other family and say, hey, do you think maybe we should test monthly, or do you think, you guys figure it out. And
Makes sense.
again, the caveat is the availability of tests and those results coming back. And so you may even could check with your doctor to see, can you help us with this?
Well, that's great advice, Dr.
Thank
Jones.
you.
I want to thank Victoria and Kelly. Great parents, and you're taking this on. You're confronting this, and again, thank you for your leadership on this, and your voices on this issue matter. We know how difficult this decision is for so many parents, and we're always glad to learn about creative ways that parents are taking issues into their own hands and not just waiting for the government to act, but are taking common sense approaches to these problems that are really in the best interest of our kids. So again, thank you so much, Victoria.
Thank you. And I so appreciate the conversation. Thank you.
Dr. Jones, you're going to stick with me because we've been talking a lot about kids, but we know when we talk about reopening schools, it's not just the kids, it's the teachers who are also in classrooms who are at risk. My next guest wrote goodbye letters to her family when she learned she may have to return to a middle school classroom in Ohio. Welcome, Terry Crothers. Good morning, Terry.
Good morning. Thank you for having me.
So Terry, I'm a lawyer and I got like chills up my spine when I read that you contacted an attorney about your estate planning when you learned that you may have to go back into your classroom. I'm glad that you're thinking about estate planning because so many people avoid having those critical conversations until they're sick and they're not able to do so. So thank you for doing that. But I was saddened to learn that you did it because of fear of returning to the classroom. So tell us, why are you so afraid to return to the classroom?
I have been, reading the research that's out there, the good research that's out there, and I know that this is a deadly virus. It's not to be played around with. I am predisposed to having some risk with it. I'm diabetic. I'm 57. So, I've worked well over 20 years to get to where I am as far as teaching. And I don't want to risk my family. I don't want to risk my students, and I don't want to risk my own life.
So what will happen, Terry, if you don't go back? Will you lose your pension? Will you lose any benefits? If you just say all the reasons you just stated to me, I'm a diabetic, I'm 57, I'm fearful of losing my life, I love my family, I love my life, I'm not stepping foot in that classroom. What are the consequences that you'll face?
There are a variety of leaves that I could take, either FMLA or the leave that's been provided through the CARES Act, which is a 2/3 reduction in pay. Those are a possibility, and the amount of sick time that I have built up. There's no guarantee that a job will be available for me, though, when I return. Not to mention my kids are going to get shortchanged if I'm not there online or in person to work with them.
Is that an option for you, Terry? Is your district in Ohio giving you the option of either stepping inside the classroom or teaching virtually?
Not in my district, it isn't. It is for the students. They do have the option of online or actually in the classroom, but for teachers, it's all in.
So if you go into the classroom, are the kids coming in, or you're just going to be there teaching the kids online?
I will be there in the room with the kids who have opted for the in-person learning. So.
And I want to bring you back into the conversation, Dr. Jones. A lot of focus on kids, and particularly this new report that said 97,000 kids, contracted COVID just in the last 2 weeks of July. But what about teachers? Teachers like Terry. Terry's not an anomaly. She probably represents, the majority of school teachers in public schools, teachers who are over 50 years old, who have pre-existing conditions. Is there enough focus on what may happen to someone like Terry if they step into a classroom?
I think we definitely need to focus on everyone, the kids, the teachers, all involved, as I've said. My sister's a teacher. My cousin's a teacher. She just sent me a message through Facebook yesterday stating how worried she is about going back into the classroom coming soon. And so this is of concern for me. And I feel for you, Terry. I know a lot of doctors who have written their wills and planned their estates being on the front line. So we are all in this together. We're all in this together. And so I really think that we need to give teachers options as well, especially those teachers who are at higher risk, because these will be the individuals who really suffer if they get COVID, and who are likely to have worse outcomes.
Yeah, I don't think we can really underestimate what we're sitting here having a conversation about. We've seen school shootings, we've seen other, tragedies that happen at school, but I don't know if we've ever had en masse teachers around this country talking about preparing wills, doing estate planning, and writing goodbye letters to their family members because, they have to walk into a dangerous situation to do a job that we already know they're underpaid for, undervalued for. I think, this is really troubling to me as a parent and as a professional. And I want to bring into the conversation a union president. She is the vice president of the Chicago Teachers Union, and she's been on the front lines of, really fighting to keep the public schools in Chicago closed during the pandemic. I want to welcome, Vice President of the Chicago Teachers Union, Stacey Davis Gates, to the conversation. Good morning, Stacey. How are you?
I'm well, thank you. How are you doing?
Good. I want to bring you in because I'm sitting here with Terry. Terry's a teacher in Ohio. You represent teachers in Chicago. And Terry's telling us that she is planning her estate, that's how fearful she is of walking back into a classroom, and that if she doesn't go back, yes, there's some pay she can receive, but it's not her full pay. And it feels like to me, she's being penalized. She's being forced to make this decision between walking into a dangerous classroom or suffering some economic loss. And why are teachers being faced with those kinds of really, unfair choices?
Well, it is an unfair choice, and I'm glad that you centered that. And it's not just an unfair choice for Terry, it's an unfair choice for everyone in the school community. No one should have to make that choice. We know that in countries where the curve has flattened, that the government supported families. And that's the argument here that, we have to surface is how is our government supporting families in this moment? It's not just returning to school, but can parents be home with their children in order to support their learning and their safety at home? Can we make allowances for those who are unemployed? Can we make sure that we continue to put a moratorium on evictions throughout this country? We have to center this in a discussion where schools have been used to mask the social inequities that we are experiencing as a nation, especially those social inequities in Black communities, immigrant communities, and Latinx communities. And so at some point, we're going to have to come to a reckoning as a country that says we need to reestablish a social safety net, that schools are not those things, but we also have to make sure that the people in the schools, from the staff to the students to the faculty to the administration, has a place where they can voice what good policy looks like, not just academic and school policy, but also what does policy look like for the health and wellness of those inside of it. Many of our schools don't even have a school nurse. So when we talk about reopening schools in the middle of a pandemic, we also have to take inventory of what our school communities do not have after years of austerity.
And thank you for pointing that out, Stacey. You're right. And definitely in inner city schools, not only are there not nurses, there aren't books, there aren't desks, there aren't all kinds of things when you think about how we're going to do this in a safe way. So I want to ask you, Dr. Jones, what is the biggest health risk to someone like Terry or any of the teachers that Stacey represents if they go back into a school and we see that crowding of kids in that hallway? Is it even realistic to think that that's not going to happen, particularly when you get to, middle and high school age kids? And what is the risk to someone like Terry when that does happen?
The risk is getting COVID and then taking it to your colleagues in the break room and potentially taking it home to your elderly parent or family member or to your kids and your spouse, and the spread continuing from there. And that's the risk. That's what we are worried about. And if any of those outcomes turn bad, where you're hospitalized or even die. And so this is the risk, this is the fear, this is the uncertainty.
So Terry, before I let you go, I just want to know, how are you going to make that ultimate decision? I assume, the days are numbered in terms of what you have to do and when you have to do it. How do you make the final call on this?
I'll be going back in the classroom. I'm going to have to make some, different arrangements. Both of my parents are elderly and they are health compromised. So I'm going to have to make arrangements for someone to help take care of them. I'll have to be back into the classroom. Like I said, I've worked so long and so hard to get where I am, and I hate to just see it thrown away. I'm going to have to make that risk. I heard from my principal today that they're going to put some barriers up on the tables in my kids' classroom. And I'm adding a barrier between my desk area or work area and the students also. So, wearing my mask, wearing a face shield, washing hands, I'll just do the best that I can and hope and pray that we can keep it at bay.
Wow. Well, Terry, we wish you luck. We
you.
hope that things go well for you, and not just for you, but for all of the teachers and the staff
Absolutely.
that are going back into, those schools in your Ohio town. And we just hope that the precautions and the measures that you just described that are going to take place are enough to keep you safe. You have invested a lot. We thank you for your years and your decades of service to our kids. Teachers deserve a lot more praise, and you all are incredibly brave, courageous, and we couldn't imagine, the future generations being where they are today without great teachers like you. So again, thank you for your service to this country and to our kids, and good luck to you.
Thank you for having me.
These are such tough decisions. I want to bring into the conversation now Dr. Lee Childress. He is the superintendent of the Corinth, Mississippi School District, and his school district actually opened to in-class instruction a couple of weeks ago. Welcome to the conversation, Dr. Childress. How are you?
I'm doing fine. Thank you for having me today.
So you've been listening to Stacy, who's with the Chicago Teachers Union, and she's been a vocal opponent against Chicago schools opening in any form that welcomes kids back into a classroom. In fact, Stacy, we know that teachers were actually outside of City Hall in Chicago protesting and calling out the mayor of Chicago for a plan that was to open the school for 2 days a week. And we know that as a result, now the Chicago School District is not going to open. So when you see Dr. Childress, someone like Stacy fighting to keep schools closed, you listen to someone like Terry, who's a teacher, who says she's frightened, so frightened that she's saying goodbye to her kids. I just wonder, what was your thought process when you reopened the schools in Corinth?
I think that's a very good question. And I certainly understand and agree and respect what both Terry and Stacy have had to say. But it was not just my thought process. So let me be the first to say that. We had been working on a plan to look at what we wanted to do in terms of reopening school for a fairly long period of time. And we are a small school district with about 2,700 students in our district. And so about 12 or 13 weeks ago, as we truly got into the development of a plan, we began to do Facebook Live sessions and bring our community along with us as we went through that process, sharing with them what were potential plans, what were procedures that we would have in place. We had involvement of teachers, staff members involved in that planning process. Then as we formulated a plan and as we began to have a draft plan, we presented that draft plan to our community. I shared that with them on a Facebook Live session. Then we followed it up and we gave them an opportunity to respond to a survey where we could take into account what our community thought about our schools reopening. And overwhelmingly, the parents wanted to reopen our schools. Teachers were very interested in seeing and staff our schools reopen. And that's what we followed through with. But we gave children an opportunity that they could either come to school on a traditional model for face-to-face instruction, or they have the virtual opportunity, the opportunity to participate in a virtual learning program.
But we know, Dr. Childress, since you reopened, haven't you had at least 6 kids who were infected? You've had a teacher, and over 100 of your students have had to be quarantined.
That is in fact correct. And I think that what we all are going to have to understand is that it is inevitable that when a school opens up, whether the school opens up on a traditional schedule or a school opens up on a virtual schedule, there are going to be children and there are going to be staff members that are going to become infected with the COVID-19. And so it's an issue that we're going to have to deal with. The key is do we have the procedures in place in the schools and in the school districts to make sure that we can conduct contact tracing, all of those types of things. And that's one of the reasons that we do have the children that have been quarantined at this point, is because our contact tracing procedures that we have in place are working. It just so happened that we had a couple of children that were involved with athletic teams that gave us a fairly large number of children that had to be quarantined. But what we're going to be seeing is this week, a large number of those that are being quarantined will be coming back into the schools over the next several days. Many of our cases that we have looked at and have talked about were identified in the first week of school or in the first 6 days of school. And we know that a lot of that probably dealt with community transmission. And I think that's the key that we have to understand, is you have to look at what the community transmission is within your community in terms of making a decision.
But Dr. Childress, let me say this in terms of Mississippi. Mississippi has been one of the hardest hit states in the South. And soon, by some reports, will take over Florida, will overtake Florida in terms of per capita cases. So when you talk about community spread, your state is one of the states that has been hit the hardest. And so I don't know, how do you, again, reconcile the two? If you're in a state that's been hit really hard, and yet you've already had this huge number of kids that have had to be quarantined, do you still think it's safe to keep the school open?
Well, I think you raise a good point, but what you have to keep in mind, and what you have to keep in mind with all school districts and with all states, while Mississippi has been identified as a hotspot, Mississippi has over the last 2 weeks begun to see a decrease in the number of cases. But what you have to do is you have to look beyond Mississippi data, and you have to look at your own community data. And that's one of the things that we are very conscious of, is looking at the data and looking at the data specifically by our county. And if you look at Alcorn County data, you will see that we just have slightly over 400 cases in Alcorn County. So our number of cases is not as great, or we have not seen the large spikes like many Mississippi counties have seen.
Stacy, Dr. Childress says you have to be prepared to deal with it with regards to when you reopen. You have to be prepared to deal with infections and quarantining. Is that your position? Do you think you just have to deal with it?
Well, we're not ready to deal with it. That was our contention to begin with here in Chicago, is that you couldn't tell us that we were ready to deal with it. It wasn't just simply about increasing cleanliness in the building for high touch areas. It's also an evaluation of the HVAC systems in many of our school buildings, and they're older buildings. Do we have the infrastructure to actually keep individuals safe once they come back into our school communities? Do we have a nurse in every single school community? No. And here's the part that I think is lost in this discussion. It's not just about mitigating risk or the inevitability. It's about long-term health care. Many of our students are not fully insured. They come from households that are low income households. And how do you maintain a continuity of care once you have it? This is a new virus. We don't know all of the impacts that this virus will have. This virus is also disproportionately impacting Black people, immigrant families, and Latinx families. How do we account for the long-term care of people once they have been infected with COVID? How do we ensure that they have health care so that they can visit a doctor? We have food deserts here in Chicago. We also have hospital deserts here in Chicago. All of these things are not necessarily accessible. So when you are factoring in inevitability, you also have to be clear about the people who have access and the people who don't have access.
And Dr. Childress, again, doing my research, and you can correct me if I'm wrong, because I had your student population in 1900 and you told me it's 2,600, but that same research I did said that 40% of your population is African American. So to Stacy's point, when we look at the population, and we know disproportionately African Americans are at a greater risk of contracting and dying from COVID. Does that concern you that you have 40% of your population of students who are going home to Black mothers and fathers and grandmothers and grandfathers who may have pre-existing conditions that make them particularly vulnerable to COVID-19?
It does, and it does concern me for all children. And I'm going to go back to what Stacy said. I think it's important that you have to look at the vast differences that exist between school districts. And there, of course, is a vast district between a small school district and an extremely large school district. And we have been very, mindful of that. And so it is a concern that I do have. But yet it is one that, our community overwhelmingly were interested in opening our schools. And we gave everyone an opportunity to participate in that survey.
And Dr. Jones, I want to go back to you because again, this inevitability is making me a little nervous, I think, because I run a big organization. I have lots of employees, and we had to make the decision about, transporting everything online, sending our employees home to work from home. And I'm really, really nervous about ever bringing people back into a setting, in an office setting or a building setting. And I'm not so certain that people are prepared to accept that it's inevitable that people are going to contract COVID. And I think the worst thing ever for someone to do, whether you're a school district or an employer, is to bring people into a setting, someone gets COVID and they get really sick or they die. So should we be thinking that it's just inevitable that people are going to contract COVID? Is that a way to think about bringing kids back to school?
As a pediatrician, one of my goals is prevention. And so I cannot accept the inevitability. We're hoping for a vaccine, which will prevent getting COVID-19, right? And so we just can't bank on inevitability. Of course, some people are getting this infection. Some people are dying from this infection. People will get this infection, but we still have to do everything we can to prevent as many people as possible from getting this infection. And here in our state, our president of the Florida chapter of AAP did send our governor a letter saying, hey, our numbers are too high right now to open school. And this was back in mid-July. And so the community spread, the numbers in your community does matter when making that decision to open and how to open. And also, as I forget your name, the young lady in Chicago said, the resources, the capabilities, the buildings, everything factors in. All things need to be considered to keep kids and the staff and the school safe.
Dr. Childress, are you guys doing temperature checks? Is that one of the things that you're doing in terms of your safety protocols?
Absolutely. We have multiple measures that we have in place. We have thermal scanners that the school district purchased. Every child and staff member are scanned each day upon arrival at school, and we are able to do that in a fairly expeditiously manner. The second time, one of the things that we also do in our pre-K through grade 8, those two schools, is we do a midday temperature scan. And the reason for that midday temperature scan is that we do know that sometimes children are given medications that will temporarily reduce a fever and allowed to come to school, even though we're discouraging that. But we do that midday scan to see if we have elevated temperatures. And if we do, in fact, see those that are taking place, then we're immediately going to notify those parents, because I'm going to have to agree with what Dr. Jones said. Schools have got to put in place any and all strategies that they can to mitigate and to try to work toward prevention. And we've got to work to continue to educate our parents and educate our children, not only on COVID-19, but also on, what are those good personal hygiene practices and things that we have in place. And that's what some of the things that we are working to do, along with many other measures that we've been able to put in place in our schools.
Yeah, and I just want to say, I really appreciate, Dr. Childress, that you went through this process of getting your community involved and giving all voices. But to be honest, the voices may be confused. Let's face it, we've gotten so much misinformation and contradictory information. So I don't even know if we can rely on even parents' input to the extent that those parents have been given bad information. So I think what has muddied the water, even for us parents, even sophisticated parents, is we have Dr. Burke saying distance learning should continue in those areas that have seen a spike. And then we have these governors pushing forward saying, no, we've got to have all in-person classrooms instruction. And you say, Dr. Childress, you're doing temperature checks, but Dr. Jones, what's a temperature check going to do if someone's asymptomatic? And we know there's so many asymptomatic people out there. So is a temperature check even worth anything?
There certainly is a role for doing temperature checks because you can catch those kids who do have a fever and keep them from coming into the school. A lot of times, even in practice, parents don't realize their kids have a fever. And children run around and play and they're happy and they don't look sick and they have a fever. And I'm like, did you know she had a fever? And so I can see where temperature checks can play a role in reducing the spread of the infection.
And what about those guards? We've seen those plastic guards on desks. Again, you can do temperature checks, you can do guards, but then you still have hundreds of kids crowding into a hallway. So are you just undermining the good work of your temperatures and your guards if kids are walking in a hallway, not keeping socially distanced from each other, not wearing masks, which I can imagine is close to impossible to enforce in a school setting?
Well, that is where I would differ with you, because one of the things as a part of our plan is that we required all students and all teachers to wear a mask. We initially had a plan that we would allow pre-K through grades 3 children to take mask breaks if they were socially distanced. And those classrooms in our school district were much easily to social distance. However, the governor did issue but let me say before that, but then all children in grades 4 through 12 had to wear a mask along with all staff members at all times. The governor last week issued a mask order that all children that were attending public schools would be required to wear a mask. Let me say, we have had very little difficulty with compliance. Students are complying with that with very little problem.
Is that including also that the crowding of students? You've seen those pictures, Dr. Childress, of students being in a hallway together. Have you had that situation in your school district at all?
We have not had that situation in our school district, except for on the first day, which I will admit, on the first day of school, as everyone was trying to get into our high school, we did have a little bit of crowding there. We have established one-way zones in the hallways. We have established one-way stairwells where we have a multi-story school. We have set up dividers where we keep people separated as they're going through a common area to try to avoid that congestion. While these are small things that can be done, these are things that can be done to eliminate, as you say, those overcrowded hallways. When we look at our children that are in pre-K through grade 6, those children are served in self-contained classrooms. They are pretty much in a cohort group and do not intermingle or mix with anyone. except for when they are being dismissed from school. And dismissal is much more orderly than it has been in the past from a large holding room. So lunches are served in the classrooms. They go out for PE with their individual class. They go out for recess with their individual class. So where we can separate these children into cohort groups, we're doing. But we are finding that, while our hallways, might be, that's where children do have an opportunity to be in a crowded hallway, as you mentioned. We don't think it's crowded. Also, our time between classes runs between 3 and 4 minutes.
Stacy, you represent hundreds, if not thousands of teachers, thousands, I'm sure tens of thousands in Chicago. What do you think about these protocols that we're hearing, not just from the Corinth school district, but others around the country that have tried to reopen? We've seen a lot of schools that have tried to reopen and they've had to immediately shut down because of the inability to follow these protocols. Was that a calculus for the Chicago school teachers and your union? Was there some concern or really distrust around the ability of schools to adhere to any of these protocols?
Well, I would say as a mother of 3 public school students that it has been difficult to adhere to it as a parent, and trying to get my children prepared to live in a world where a face mask is a reality. And as a high school history teacher, the mask becomes the new power struggle in the school community. The mask becomes the new thing that gets policed in the school community. We have to be, I think, clear about what is happening right now in our schools. I hear a lot of people talking about getting back to normal. Everything that Dr. Childress just provided to us is not normal. And this journey for normal, it's not going to happen until there's a vaccine. This journey for normal probably will never happen for communities of color that do not receive the necessary supports that are required to recover from the impact of this pandemic on our communities. So I just want to be clear that I do not believe that our school district had the infrastructure, and it wasn't just our union. In fact, Black parents and Latinx parents here in Chicago were overwhelmingly pushing back against a hybrid plan or any plan to bring their students back into school communities. And why wouldn't they? Their families have suffered the most under COVID. Many of our parents are frontline workers in nursing homes and hospitals and grocery stores, and they saw that their employers were not always able to maintain safety for them. So why would they have the trust that the school communities would maintain safety for their children? There is a gap in what many of our institutions tell us that they will give us and the reality of it. We saw nursing home workers having a mask for a week. The lack of availability for PPE, in every region of this country has been a big deal. And so we add to that our schools. And, one of the other things that hasn't been talked about is the stress that reopening of our schools will put place on, our hospitals. We do not know what will happen to our hospitals as a result of schools reopening, because even the example that we just are learning about in Mississippi, children have had to quarantine. What happens when children have to quarantine and then their families get ill? What happens when you live in a multi-generational household and the domino effect that it has on our society? So it's not just about opening our schools. It is about the virus and how it will continue to impact, because we've watched this play out already.
Well, you raise an excellent point, Stacey, about the quarantining in multi-generational families and low-income families who live in small apartments. So that child that comes home from school now that has to quarantine essentially is exposing that entire family. And that family, we know a lot of our Black and brown families, our families in low-income communities don't have the ability to separate into, 5-6 rooms in a house, because there isn't 5 or 6 rooms in the house to begin with. So it is a much bigger issue than what happens at school, because what happens at school then translates to home, that translates into the community. But before I let all of you go, I just want to ask you one last question about our federal response to this. I think that's what's been so frustrating. And you heard Victoria, one of the parents on earlier, talk about the poor response from the White House and how that has impacted what's happening at the school level. But Betsy DeVos, she is the Secretary of Education under the Trump administration. She has been one of the fiercest proponents of reopening the schools, although they've not laid forth what some school districts believe to be a credible scientific plan for how that should happen. So I'll start with you, Dr. Childress. What is it that you would like to see right now from Secretary DeVos that could, make this situation better and give parents real certainty that their kids are going to learn and be safe?
I think what would have helped everyone is if everyone could have gotten on the same page in terms of guidelines, in terms of recommendations prior to schools beginning to restart. Because we know, we're on a modified calendar. We started a little bit earlier than everyone else. However, as Dr. Jones has mentioned, as we have seen in Mississippi with the American Academy of Pediatrics, we had a letter saying, encouraging, looking at that. We have not had any really clear guidelines from the federal government. We've had what are considered to be a lot of considerations. And it's really good to get considerations, but ultimately you have to put in place guidelines and procedures. And that's something that has been frustrating is we've had to deal with conflicting information, conflicting recommendations. And that's why I go back to, it's been very important, for there to be strong community input and strong community involvement in making that decision.
A great point, Dr. Childress. How about for you, Stacey? What could Secretary DeVos do now to improve the situation that so many families find themselves in, particularly families I advocate for, which are low-income families, families with kids with disabilities? We haven't even talked about kids like mine who have autism and the regression that our kids are experiencing because they're out of school, haven't been in school for 5-6 months now, and not having that face-to-face interaction with their aides, with those special education instructors. My own son has regressed tremendously. So my heart goes out to all of those families. We have to have a whole nother show on that, but what could Secretary DeVos do right now to improve the situation?
Resign. That administration is absolutely awful. And you can't get, water from a rock. It just, you can't do it. And they have failed our nation. There's no way in the world that we should be having the discussion to the extent that we are having, and other outlets continue to have, about the abject failure of the Trump administration. You can't help that. The only thing that you can do at this point is vote it out.
Okay, that's a definitive response. Resign. Okay, I'll give you the last word, Dr. Jones, because you've been so gracious. You've been with us all morning, and you're just helping us understand from a scientific standpoint. So, what would you like to see Secretary DeVos do that could improve the situation for not just the kids, but for the teachers, the staff, and the parents, particularly those parents who have to go to work and who are going to say this distance learning is too challenging when I'm also managing a job, multiple kids in different grades, and the stress that COVID has just, wreaked on all of our lives.
Right. First, I have to say, I love Stacey. Stacey, that was a very good answer. Dr. Childress, I want to say thank you. With a lack of planning and guidelines, I really support that answer because we need to get on one accord. We need to have a clear, concise plan and guidelines that is based on evidence from our leaders at a national level, at a state level, and at a local level. If those individuals can't be on the same page and can't be providing information that is based on evidence, we are all in trouble, as we all are in trouble right now. And so that I agree with him on that. And that's basically it. And I think that we all are hoping for that. And as far as DeVos, I think she needs to have more diversity around her, and consider all Americans, all colors, all economic status, all of those social determinants of health, and have key individuals with the knowledge of those separations around her to make the best decision, because I think her decisions are jaded into just her world.
Well, thank you all. I agree with each and every one of your points. We could start with the resign. Absolutely. We've been failed by this administration, no doubt about it. And it starts at the top. And Betsy DeVos, as a part of the cabinet, is a part of that failure. And Dr. Childress, I feel your pain as a parent. All of these conflicting statements and conclusions and recommendations are not scientific directives, which is what we all need. And Dr. Jones, thank you for clarifying where the AAP is, because your voice is important. And we got to keep this around the science. We got to keep the science. We got to keep doctors like you that make this, this is your life's work. We need to be listening more to you and less to the politicians. So again, thanks to all of you for joining me for this critical conversation. Stacy, Lee, and Dr. Jones, keep lifting your voice on these critical issues. Our kids need you, and teachers like Terry definitely need you more now than ever. So again, thanks to all of you for joining me this morning. Wow, every time we have this conversation about schools, I don't know if we learn more or we just end up more confused, but you know what? This is the special report, and we're going to keep having these critical conversations, and we're going to keep doing a deep dive on these difficult issues. They are not easy. And as schools are reopening and having to close because kids can't follow the protocol or because schools don't know what the protocols are, we're going to keep our eye on this, because ultimately the safety of our kids is what's critically important. Before I get out of here, I always want to give a shout out to my production team for the great work that they do in bringing us all of these super guests. And again, thanks to our sponsors for allowing us to have these conversations about our kids and about what's happening around COVID-19. You can continue to be a part of this conversation by following me at Areva Martin on all social media platforms. Before I get out, always some words to live by. You know, this government has put parents between the proverbial rock and a hard place. We are right there. We're right in between that rock and that hard place, because Trump spent months downplaying the virus, failing to develop a national testing and tracing strategy, failing to provide schools with consistent, scientific, coherent plans to reopen. So now here we are into the new school year, and our kids, yes, our kids are being offered up as guinea pigs for school districts trying to do the impossible. Some are doing it to appease governors and to appease Donald Trump, and others just stubbornly refuse to follow their own health directors. And then there's some like Lee Childress, Dr. Childress, who believe he's doing what his community has asked him to do based on the input that he's received from that community. But no matter what the reason, the reality is our kids deserve better. And we have to be honest with ourselves, and we have to just confront the fact that we have failed our kids. But you know what? It's not too late to course correct. It's not too late to do what's right for our students, for teachers, for our school staff, to do what Dr. Birx and other health officials have suggested. And that's just, don't open schools. Don't open schools until it is safe to do so. Don't put low-income Black and brown kids at risk, because when you do, you're putting their families at risk. You're putting our communities at risk. You're putting essential workers at risk. And it's time for us to put our kids first and not put them at risk. And as a parent, again, of a special needs child and 2 college graduates who were homeschooled, I know how this can be so incredibly challenging, but I also know that we can do distance learning, and we can do it better until we can make it safe for kids to return to the classroom. So I wish there was more resources and time and energy and effort put into making distance learning something that it really can be, which is a great way to educate our kids in a safe environment until they can walk back into those classrooms. This is going to take a lot of courage. It's going to take a lot of commitment. It's going to take a lot of resources. But guess what? What doesn't? Our kids are watching, and they are counting on us to get this right. I'm out, y'all. Be safe. Remember to wear your mask. And remember, we are all in this together.